Good morning. This is Skokie Institute of Allied Health and Technology. I am the Executive Director, Dr. Bella Kaiser. This time, we are also presenting a topic that's a little different from the webinars that we usually do. We are actually talking about Health Literacy Month. October is considered a literacy month. So we want to give you a little information about what is Literacy Month and basically why is it important. So first of all, our introduction. We are Skokie Institute of Allied Health and Technology. We are nonprofit, and our purpose is to provide the community with hands-on training and education, leading to economic independence and entry-level positions. We qualify and we basically provide career training in allied health, fitness, and nutrition programs. We are an online institution and we are community and student centered. We are affordable, flexible, and we value our students and their career training more than anything. Right now, we are enrolling for fall and fall winter terms. You register with the programs and then you receive a free tablet along with save on tuition because you'll notice our tuition is lower compared to other vocational schools. Uh, you can find all the information on our website at SIAHT.org. Another is that we have good news. Skokie Institute of Allied Health and Technology now provides with financial aid for students. SIAHT has partnered with Climb Credit, and the purpose is to provide students who are looking for a career training but are not able to afford the tuition of that school and therefore keep on delaying the process can actually now work with Climb Credit as Climb Credit and the Institute of Allied Health and Technology has partnered together. You can find the information on our website or site.org tuition information. So October is Health Literacy Month. So what is Health Literacy Month? Basically, during this time, organizations and individuals promote the importance of understanding health information. So basically, you as an individual need to understand and should be aware of what you need to do in order to make sure you are healthy and stay healthy. Literacy Month brings awareness to breaking down the barriers of understanding. According to health experts, there is a large gap between the way healthcare issues are communicated by professionals. A lot of time, professionals in the healthcare field will talk in their lingo, thinking that the patient understands it, but the reality is the patient does not understand anything, and that a lot of times patients are very shy in letting the physician and the health and the allied health professional know that they don't understand anything that they're talking about and about their care, and as a result they become negligent. That causes them, instead of getting better, to get worse in their medical condition. Helen Osborne was the one who founded Health Literacy Month in 1999, and she said the theme for Health Literacy Month is be a health literacy hero, meaning be your own advocate and know what you need to do in order to keep you, yourself, and your family members and your loved ones healthy. So, what is health literacy? Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information, and also understand the services that they need in order to make health decisions. So, it is actually dependent on both individual and systemic factors. So, communication, first of all, communication skills. Health literacy is also something that the allied health professionals and clinicians need to be aware of because they need to understand that they're communicating with the patient in the medical language, and the patient does not understand anything. So communication skills is a big one. Knowledge of people and profession. So we cannot assume that everybody who comes into the office is knows medical language. Culture, it also depends on which culture they're from. So health literacy also means that that as a clinician and as a professional, we need to understand the patient's cultures that we are dealing with, demands of healthcare and public health system, and demands of the situation. So why is health literacy is important? Because it affects people's ability to, first of all, navigate the healthcare system, including locating providers, services, and filling out forms, understanding what forms they need to fill out, what they should know before they go to a physician, knowing your own family history, personal history, share personal health information with providers, engage in self-care and chronic disease management. So patient also need to understand that they would be able to control their disease, their health by exercising, adopt health promoting behaviors like exercise, eating a healthy diet. So health literacy in this case also means they need to know what is a healthy diet, act on health related news and announcements. The outcomes basically impact health outcomes, healthcare costs, and quality of care. If you as an individual are more self-aware, then you will know how to manage your conditions, your family history, that um, and then this way you will end up going uh, spending less money, having less healthcare costs. How is this affected? People with limited health literacy have high utilization of treatment services. So if they don't know what is wrong with what with them or with their loved one, they're going to go to the doctor more. They'll be more hospitalized, more emergency services, and if the patients have lower utilization of preventive services, they will go to the hospital more, and then that will cause them to have higher healthcare costs. So that's why being a health literate person is very, very important. How is literacy measured? As a clinician, as an allied health professional, fitness or nutrition professional, tasks that we can use to measure health literacy of patients basically were organized around three domains. So clinical, meaning patient's ability to fill out the patient form. Prevention, following guidelines for age appropriate preventive health services. So we know that as we turn 45, women should have a mammogram. Um, if they have cancer in their family, a family history of cancer, then they have to have a colonoscopy, mammogram. So these are age-appropriate preventive health services. Navigation of healthcare system, meaning understanding what their health insurance plan is, what will the health insurance plan pay for, and what is then the patient's responsibility. So if you have a person who knows and go through all these things, then you know that the person is health literate. How to identify literacy in a health literacy in an individual? Well, if we are as a professional want to make sure that the patient we're dealing with is health literate or not, we'll know if the patient misses their appointment, if they give you incomplete registration forms, if they're not complying with medications, if they're unable to name the medications, if they're unable to explain the purpose of the medication that they're taking and the dosage, if they are not unable to identify the pills by looking at them, not reading the labels, unable to give coherent sequential history, meaning not knowing their own history or family history, they're not asking questions, and then there's a lack of follow through on test or referrals. So what can we do as allied health professionals? So this is where we come in as allied health professionals, fitness and nutrition professionals. We should always remember that, first of all, use plain English, plain language, words that everybody can understand. Limit information to 3 to 5 key points. If you give too much information to a patient and they might be a health literate person, they'll get confused because it's too much for anyone to grasp. Be specific and concrete. Don't talk about general stuff. Talk about what specifically is important for their health. Demonstrate, you can draw pictures, use models, and then the most important thing, repeat and summarize. Repeat what you just said and then have the patient summarize it. Then teach back and confirm that they're understanding, and be positive, hopeful, and empowering. So, in other words, take time with your patient. So, now connection to SIAHT. Basically, the reason why we wanted to bring this information to your um, home is because SIAHT has programs on fitness trainer, nutrition, and wellness coach. And in allied health, we provide patients with medical billing, insurance, and medical billing and insurance specialists, neurophysiology, and pharmacy technician. This section basically is a portion that's covered in our main prerequisites. We talk about this in medical terminology, anatomy, physiology, exercise physiology, nutritional assessment, and community nutrition. We talk about how we can empower our patients, we can empower our community, and make sure that what we are talking to them about their health, they understand. And then another thing is that we should not always expect the patient to remember. So what we teach them, we also provide a handout to them, something that they can read and keep with them. The students are taught about the different topics and ways to communicate with their community and help as a professional, and how they can work with patients to help them live a healthy life. So this was a small webinar. I really hope that you enjoyed it. Just wanted to give you a little outline about our own website. This is what our website looks like. It has all the information a student needs, and they can contact us at admin@siaht.org, or you can call us at 847-461-4472. You can also visit us in person and make an appointment. We have contact form on our website that can be used to request an appointment, and the appointment staff will contact you and have you meet with the college staff. So this is just an office view. This is what our office looks like from outside. There's a parking lot available if you need parking. This is our reception area, and then this is our business lounge, which is also our waiting lounge for the patient, for the students. We are also on social media, so please do follow us on all the social media. We are located on Twitter, Facebook, Instagram, LinkedIn, YouTube, Pinterest, and also on Google Business. Like us, get all our updates, notification for Health Awareness Month, and more. Last year, we did quite some health awareness for October. We talked about pharmacy technician weeks. We talked about different topics. Those can be found on our YouTube channel. Um, and we will be back next time with another topic. And I really hope you enjoy this. Please do comment. This video will be put on YouTube, so please do comment on our webinar, letting us know how we did. What is it that you would like to see more talking about? What specific topic that you would like us to discuss? Let us know, and we will make sure to bring that to you next time. Okay. I just stopped it.